Hello friends, we are the students of Bishop Benziger College of Nursing, Kollam. I am Archana Oje. Now I am here to talk about chronic obstructive pulmonary disease, COPD. The 2020 theme for World COPD Day is Live Well with COPD, everybody, everywhere. This year's aim is to send a positive message to both patient and providers that although COPD does not have a cure, but there are many ways to actively live well. So, let's see.
Chronic obstructive pulmonary disease or COPD is a lung disease that causes difficulty in breathing. COPD is a long-term disease that often gets worse over time, and it is characterized by inflammation and severe limitation of airflow in and out of the lungs. COPD is an umbrella term used to describe a group of breathing conditions, the most common being chronic bronchitis and emphysema. Many people living with COPD may have both emphysema and chronic bronchitis. A few people have both asthma and COPD.
Let's see the causes of chronic obstructive pulmonary disease. First is cigarette smoking. It is the most common cause that causing chronic obstructive pulmonary disease and it resulting the damage of bronchial and alveolar valves. Second is air pollution. Cooking with biomass fuels can lead to COPD. The third one is occupational exposure. Exposure to the fumes, chemicals, dust, and working place for a long period of time can cause chronic obstructive pulmonary disease. The fourth one is infection. Recurrent infection can cause COPD. Fifth one is low social economic status. Sixth one is cannabis smoking. And finally, genetic factors.
Shortness of breath, wheezing, chest tightness, a chronic cough that may produce sputum that may be clear, white, yellow or greenish, pursed lip breathing, frequent respiratory infections, fatigue, swollen feet, ankles or legs, cyanosis, and in later stages unintended weight loss.
Almost all COPD cases are caused by cigarette smoking. Never smoking or quitting if you already smoke are the single most important steps you can take to reduce your risk of developing COPD. Try to avoid or limit exposure to secondhand smoke, dust, fumes, environmental smoke such as smoke from burning wood, charcoal, etc. Avoid close contact with people who have respiratory infections like pneumonia and acute bronchitis. Medical treatment: bronchodilators, theophylline, steroids, pulmonary rehabilitation, supplemental oxygen therapy, over-the-counter cough suppressants such as dextromethorphan. Lifestyle and home remedies.
Nurses have a central role in the care and management of people with chronic obstructive pulmonary disease. Many nursing roles are ideally placed to support patients to live well with COPD. As we discussed that COPD has no cure, and although medication can help to mitigate some of the symptoms, it cannot alter the inevitable course of the disease. Particularly as COPD becomes more severe, the need for ongoing routine surveillance and the possibility of escalating treatment regimens brings patients into frequent contact with nurses.
Chronic obstructive pulmonary disease is a chronic inflammatory lung disease which causes the obstructed airflow from the lungs. Symptoms include breathing difficulty, cough, sputum production and wheezing. It caused by long-term exposure to irritating gases and particulate matter most often from cigarette smoke. However, chronic obstructive pulmonary disease can be easily treated and prevented. The best way to do this is to stop or never start smoking. Thank you.